Hi, this is Dr. Corey Maas on Looking and Being Your Best. And I wanted to hone in on the Juvederm family of the cosmetic injection or fillers, as they're commonly referred to. And that family now has grown. And specifically, Allergan should be really lauded for what they've done, because they have taken a particular molecule, which all the companies have, which are called the hyaluronins, or often referred to as hyaluronic acid. In practice, they're very weak acids like water, but in principle, they're really cross-linked and bound, so they are really hyaluronins, and they're not giving up many hydrogen ions, which is technically what an acid is. And they're really long-chain sugars. And so these long chains of sugars, which occur in nature, and they're in our joints and in our skin, and they're in all animal kingdom, all throughout the animal kingdom, birds and other animals. And these HA molecules are cross-linked extensively to make them less susceptible to degradation by the enzymes that our body has also. And so all of the three families that are available in the US are the Restylane family and the Juvederm family, and then the Belotero family, which it just got the one grandfather, the Belotero Balance, in the US, but they'll have the other ones here, I'm sure, soon in the Belotero group. But talking about the Juvederm family, they should be lauded because they actually thought about this and created a system that is site-specific or indication-specific with their HA filler, which is again called Juvederm. And the original Juvederm XC it still is a very good product. It's 24 milligrams per deciliter, which is the highest of the ones that are approved in actual concentration of HA, which we know that isn't really that important, because what we care most about is the flow characteristics of the product and about its viscosity, which ties to flow. And then there's terms that are we talk about, but they're more sciencey, like G prime, which is it's a resistance to deformation, stiffness of a gel. But really, those things are not so important to people. I think people care about what they feel, how they feel. Are they safe? How do they feel? And are they natural looking for the most part? And some people don't care so much if they look natural, which we get to see on television and at parties all the time. But I really think that this is my personal opinion, and I share it with my patients, is that as soon as you cross the line from looking natural, whether it's with fullness or fillers or whatever you're doing, or softening of muscle tone using the botulinum toxins, into a category where it looks unnatural, then you're kind of eclipsing the beauty thing. We want to enhance what you have, make you look better, without making you look like you had something done. And I think that's a really important definition. So getting into the Juvederm products, because this was important early on, we had Juvederm XC, the Ultra Pulse, Ultra Plus, the Ultra and Ultra Plus, and they were just a little different viscosity. Their performance characteristics were pretty similar. And what's made them stand out in my mind, as we learned really early, was that all of these HAs will hold on to body water, but the Juvederm Ultra Pulse products really could hold on to body water. And so in areas like around the eyes or around the lips, it could make you look a little bee stung. And so in my opinion, those aren't the best products to be used. I think to their credit, the Allergan company recognized that this water holding capacity could be a great thing in the nasolabial fold or other areas of the face, where it actually gives a little more oomph to the filler itself, but would be a disadvantage, for example, in the lips, unless you want to look a little bee stung. So that's something that we would consider. And then they created the class of products that are called, the first of them was Voluma, which had a good, strong G prime, ability to lift. It didn't hold as much body water, and it was specifically studied in the mid-face area to lift up the soft tissues. And in the studies that led to the approval of Voluma, showed that 49%, almost half of the subjects that were treated were still in the mid-face volume loss. We call that a negative mid-face vector, where you kind of got a hollow V under the eyes. That almost half of the subjects were still fully corrected 2 years afterward. So their way of cross-linking, which they call Vicross, it's their proprietary technology that takes these sugars and sort of creates little ladders or cross-links through them to keep them from being degraded so quickly, is a product that has a long-lasting or durability in an area, this is really important, that doesn't have a whole lot of movement. So we place the voluma over the periosteum. In other words, it's not right under the skin, it's really right over the covering of the bone, and we're lifting everything up from just over the covering of the bone, and that restores natural cheek volume. Now, we've all seen it, at least probably everybody watching has seen people coming in with these ginormous filled up cheeks, and I just want to caution everyone that in order to lift the sagging jawline, the amount of filler you would have to use is tremendous. I mean, you can do this yourself by grabbing your cheek and seeing how much it changes your jawline. So I just would caution, because a lot of patients have asked me about this, and they've been told this by doctors, we'll do filler up here and it's going to change your jawline, and that's just not true. So and it makes you look strange if you get that much filler placed there. Now, there are indications where you might temporarily be that full. For example, there's a product Radias, which we'll talk about, and we have talked about, which is very small particle calcium hydroxylapatite, which is like your bone mineral, that's in a gelatin carrier, and we put local in it besides that, and then when you do the injection, you can be very puffy afterward, but that goes down after a day or two or three. So that's different than overcorrecting to try to lift a jawline, which is more of a lifting phenomenon than it is filling. So Voluma is a product that has very good data. It's been out 3 years. There have been some reports of late-term allergic reactions, which are treatable, but that's important to be aware of, that there's been some of these reports recently, which is suspected is related to the Vicross cross-linking technology, although we really don't understand it that well. And then the other products, I was a principal investigator for the Velour product, which is a very easy flowing product and was studied in the nasolabial fold and has very good duration, up to 18 months duration in the nasolabial fold, and it's nice, it's very simple and smooth to inject and does a nice job of filling, and it's also much less than the Juvederm XC product in water retention. But in some ways the XC product is great that it holds water, because it kind of lifts and fills and softens the nasolabial fold. But Velour, the Juvederm Velour product, really is like a workhorse. It can be used along the jawline, it can be used, these are off-label uses, but still very effective. It can be used in the nasolabial fold, it can be used in lips, although it does hold more water than the next one I'm talking about, Volbella, which I think is probably a better choice if you're in the Juvederm family for lips, in other areas. So I think of Velour as a workhorse sort of product for good duration, even in mobile areas. It's very elastic, it's very nice in highly mobile areas, and the data from the studies shows it to be very effective when compared to other products. So in terms of duration of effect, they're all soft. I think that the lifting capacity in terms of the stiffness might be a little greater in some of the Restylane products, but all of these can effectively give a similar aesthetic result. Now we're looking at really the indications for use and where we're using them. And the last one that I mentioned in the Juvederm family is the Volbella product, which is the only one that has a lower concentration of HA at 15.5 milligrams per deciliter. And milligrams per deciliter means how much of this HA sort of gelatin, the actual sugars that we're talking about, are in solution or in the water. And when you bring that down, and it's really hypersaturated with water, then there's less water absorption, which that's the benefit of Volbella and its use in the lips, is you don't get that bee stung look like you would with the Juvederm XC, for example. And you can really use it anywhere. I think that the application in treating the lip border and for volume of the lips for Volbella, which this Vicross technology again has better duration, is an excellent indication for use. Like I said, it can be used everywhere, off-label or on-label. is a good and reliable product, and we expect much less swelling with Vobella, and obviously a softness that the others don't have. Although again, most of these you can't really feel anyway. It's very hard to feel or find where filler is injected or not injected unless it's really over-injected. So that's my summary on the Juvederm family of products. It started with Juvederm XC, which is out there and sort of, I guess, sort of this is the grandfather of them, and then from Grandpa we got the newer, more specifically indicated products in Voluma, Volure, and Vobella. And I'm sure there are more to come as we work on these technologies. If you have any questions about the Juvederm, Restylane, or Belotero families of HA filler products, or even any of the other ones, the microparticulate, Radiesse, Sculptra, please don't hesitate to write me or send a picture or video of yourself at drmaas.com, and I'll be happy to try to get back to you. And that can be done privately or publicly. It's up to you if you want to share your image with somebody or have it just privately done. As always, it's my pleasure to help you stay looking and being your best. Dr. Corey Maas.